I'm Shannon Kelly, coordinator of OPEN, the Overdose Prevention and Education Network in the city of Cambridge. This video will take you step by step through what to do when you witness an overdose. Check out our other videos for more detailed information on calling 911, risk factors for overdose, and obtaining Narcan. Opioid overdose is a serious problem in Massachusetts. 2 people die every day in Massachusetts from opioid overdose, more than the number of people who die in car accidents. First, let's look at how opioids work. Opioids are a class of drugs that include heroin and common prescription pain medications such as OxyContin, Percocet, Vicodin, morphine, methadone, and codeine. The brain has many receptors for opioids. Too much opioid fitting into too many receptors slows breathing. In an opioid overdose, the body has more drugs in its system than it can handle, and the body shuts down breathing, which can result in coma or death. Now we'll look at how Narcan can reverse an opioid overdose. Narcan is a safe, legal medication that can reverse an opioid overdose. Narcan's bond to the opioid receptors is stronger than the opioid's bond. Narcan knocks the opioid off the receptors for 30 to 90 minutes and allows the person to breathe again. So how do you know if someone's overdosing? The person may have labored breathing, which sounds like a deep snoring or gurgling. She may be breathing very slowly or not at all. She won't respond to stimulation. Her lips or fingertips may look bluish if she has lighter skin. If she has darker skin, purplish. She may look pale. She may be choking or vomiting. The 2 most important signs to look for are slow, labored, or no breathing, and lack of response to stimulation. Morgan Coe, who runs the needle exchange in Cambridge, will now walk you through how to safely check for response to stimulation.
Sue here is going to help me demonstrate. If she isn't breathing, or if her breath is shallow or slow, she may be having an overdose. Check for response. Shout her name, give her a firm shake. Sue! Sue! If she doesn't come around for that, move around to the sternum rub. Use your knuckles and rub firmly on her breastbone. This will be painful enough to wake her up if she's passed out or asleep, but it won't cause her bodily harm. Remember, don't try to stimulate her by kicking her, holding a lighter to her skin, putting her in a shower or an ice bath. These methods could cause serious injury. If she's unresponsive after a sternal rub and loudly yelling her name, assume she is overdosing. Once you've recognized an overdose, remember CAN. Call 911, give air through rescue breathing, and give Narcan if you have it.
Overdose is a medical emergency. Without professional medical help, an overdose can lead to coma and death. The ambulance can bring oxygen and Narcan, a drug that will reverse an overdose. If you think someone's overdosing, call 911. It may be the difference between life and death. If you have to leave the person at all, even for the time it takes to call 911, make sure you put her in the recovery position. This will help to keep the airway clear and keep her from choking on her vomit. To get the person in the recovery position, lay her on her side, supporting her body with a bent knee. Turn her face to the side and rest her head on her arm.
When someone overdoses, the biggest danger is lack of oxygen. Rescue breathing can give the overdose victim the oxygen they need until help arrives. First, place her on her back. Put your hand under her neck and tilt her chin up. Look into her mouth to see if there's anything blocking the airway like gum. If there is, remove it. Gently lift her chin to open the airway. Pinch her nose closed and place your mouth over hers. Give 2 breaths into her mouth. After each breath, turn your head and look to make sure that her chest is rising and falling. If you don't see the chest rising and falling, then tilt her head back more and try again.
Once these 2 breaths go in, give 1 breath every 5 seconds. Continue this rescue breathing pattern until the person starts to breathe on her own. An ambulance or someone else comes who can take over for you, or you're too exhausted to continue.
If you have Narcan available, you'll have to stop rescue breathing to assemble the kit. This is okay. Narcan reverses an opioid overdose by temporarily knocking the opioids off the receptors in the brain. This allows the person to breathe again and regain consciousness. Narcan is free, legal, and easy to use. In each kit, you'll find the medication, the nasal vaporizer, and the delivery device. First, remove the 2 yellow caps from the delivery device. and 1 red cap from the medication. Gently screw the medication into the back of the delivery tube and twist that tube onto the nasal vaporizer. Spray half of the Narcan up one side of the nose and half up the other side. Don't worry if it all goes up one side, they'll still receive the medication. If there's no change in their condition in 3 to 5 minutes, give them the second dose from your Narcan kit. Don't forget, if you haven't called 911, call now. And if the person is still not breathing, continue performing rescue breathing. If you think someone is overdosing, remember CAN. Call 911, give air through rescue breathing, give Narcan if you have it.
For more information about calling 911, Narcan, and risk factors for overdose, check out our other videos or go to odprevention.org. Overdose is a medical emergency. Learn the steps and know what to do.